Soloing this morning on Help Monday is Jacob this morning, and Jacob Johnson, our guest. And your brother wouldn't come with you? Is he mad or something?
He is out of town this week. Good riddance to Jared. He is out of town. It was his turn. In all fairness, I was out of town last week. So
a topic that we haven't touched on is chronic kidney disease, and we're going to touch on that this morning. And exactly what is that?
All right, so March is National Kidney Month, and so when trying to figure out what to talk about this morning, this came up, chronic kidney disease. By the way, today, March 11th, is also National Napping Day. I found that in my research, so feel free to snooze while I talk this morning.
Is that what you were doing out there in the lobby?
And we'll be doing again soon.
Drooling?
Yeah. National Napping Day. National Kidney Month. Chronic kidney disease or chronic kidney failure. It's just simply the gradual loss of kidney function. And how that works is, we generally know what our kidneys do. They filter. They filter out excess fluid, wastes, electrolytes, things like that our body needs a certain amount of sometimes, but not a lot of. It filters them out, and of course eventually they end up in the urine and in the commode and flushed away. And when you have loss of kidney function, those things that you want to get rid of, the excess electrolytes, fluid, toxins, waste, they build up in your system, cause all kind of problems. And so that is chronic kidney disease.
Is this a common type disease?
More so than we want. And the reason that's an interesting question is, as of we officially know it, it's 2 out of 100. 2% of the U.S. adults have chronic kidney disease. Well, that's not a huge number. We usually in here are talking about blood pressure or something. It's 40% of the population. Well, problem with that is kidney disease, as we'll talk about in a minute, presents in ways that we don't often know we have it until much later, don't even go to the doctor, don't know what's going on. And so it's been estimated that as many as 15% of the people walking around in America have it, but we've only got 2% of them diagnosed at this point. And so it is a bigger deal than maybe the numbers suggest.
What are some of the causes?
Well, it pretty much in order of occurrence. The most common cause is going to be diabetes, especially uncontrolled. Got a lot of sugar floating around in there, puts a tax on the kidneys. Same thing with high blood pressure. A lot of pressure puts extra workload on the kidneys for years and years, and that leads to kidney failure, kidney disease. Less common reasons, but still a factor, certain inflammatory diseases of the kidneys. And here's your big words for today. Get ready. Glomerulonephritis.
So that fast.
That's interstitial nephritis. Other things like that are kidney diseases, you would know if you have them. You'd have been told. You don't have to go look up these words. Another thing that happens, and this is something for people to note, is that prolonged obstruction of any part of the urinary tract. Well, that doesn't sound like anything you have, right? Well, kidney stones. A lot of people with kidney stones. You get enough of them, you get them for a long enough time, they recur enough, they're blocking urinary tract, putting pressure on the kidneys. Certain cancers, if the tumor's in the right place, it's putting pressure on the urinary tract, causing a backup in the kidneys. And then last, for men out there, an enlarged prostate. You let that go bad enough, long enough, it's backing stuff up into the kidneys, putting pressures. All those things can cause kidney disease, including just recurrent kidney infections that people get a lot.
I may know the answer to this question before I ask it. Being a man, who is most at risk for getting chronic kidney disease?
Well, it goes back to that last question. People at risk of getting the things or already have the things we just talked about. So if you're out there and you have diabetes, if you're out there today and you have high blood pressure, you're at the most risk more than anyone else, especially if you don't control those very well with your medicines. Or any risk factor that leads to one of those two things. Obesity. Smoking. I know smokers hate me on the show because I pick on them all the time, but that's because it leads to pretty much every disease we talk about. So obesity, smokers. Unfortunately, aging. The more time you put pressure on your kidneys, the worse it is. So as you age, that becomes a factor. If you have heart or vessel disease, blockages, plaques, cholesterol issues, those lead to it. And then unfortunately, race does play a factor. Caucasians, Hispanics, less likely to get it. African American, Native American, Asian American, more likely to get it. But again, diabetes, blood pressure, and obesity, smoking are your 4 big ones.
You talked a little bit earlier about some of this stuff going on for a long time before it's even diagnosed. What are some of the symptoms of this disease?
Well, the ones that usually show up first are not ones you're going to run to your doctor and go, check my kidney. Nausea, vomiting, loss of appetite, sleep disturbances, general fatigue, Oh, okay. You know, is anybody out there this morning at
That doesn't suffer from
nearly
this type
7
of
o'clock
thing.
not going, okay, that's pretty normal stuff for me, right? Okay. Then you get a little more specific beyond that. You start to get, fluid swelling, muscle cramps from those kind of things. You get decreased mental sharpness, decreased ability to concentrate. Oddly enough, persistent itching is a really common thing that shows up as you get further down the road. And then, we said blood pressure diseases cause kidney problems. Well, flip it around, kidney problems cause uncontrollable high blood pressure. You can't hardly get it down. And so those are things you're going to see. And if it gets bad enough, difficulty breathing and difficulty with your heart because you're building up so much fluid in your chest cavity.
Yeah.
So you get a lot of that.
Wow. Can this lead to other health problems?
Unfortunately, there's a few health problems that lead to kidney disease, but then once you get kidney disease, there's a whole cascade that follows. And so, the obvious ones being, we just mentioned, you can't control your blood pressure. Your doctor tries this medicine, that medicine, another, a third, a fourth, and your blood pressure, it's really hard to control. Fluid retention, you've seen people that just blow up with fluid at times. That can be a sign, something coming from kidney disease. It's hard to get that swelling out of your limbs, which also increases your blood pressure, makes it hard to breathe. Increased potassium is a big one. Doesn't sound like a big deal. My doctor tells me to eat more bananas and oranges, so that can't be that big of a deal, right? Well, high load of potassium can cause immediate life-threatening heart rhythm issues, anemia, bone weakness and fractures. Goodness, it goes on. Damage, again, we talked about difficulty concentrating. It can damage your brain to the point of seizures, difficulty just thinking and formulating thoughts, messes with your immune system. You get sick more often. You get a lot of swelling even around the heart. Pericarditis is the name for that. So the problem is a lot of these things are irreversible. And when you get to that point, the next step is you may end up in terms, and we'll get to this later, of transplant, dialysis, things like that, as long as these things keep going on.
Wow. Hopefully, after all this information, there are some treatments out there available that can help.
There are. Unfortunately, there's not a magic pill. So you take this pill because you have kidney disease and your kidney disease goes away. That's not how it works. That's unfortunate. Fortunately, however, we do have things to control it. And it's mainly controlling the causes. That's step one. So if you have blood pressure, diabetes issues, step one, we've really got to work on your blood pressure and diabetes. Let's stop further damage, because what good does it do to treat it if we're just going to keep damaging it more and more? So let's stop the damage by getting your blood pressure and your diabetes under control, doing what your doctor and pharmacists are asking you to do, taking your medicines right, paying attention. But then we treat all that cascade of other problems we just talked about. We're going to give you diuretics. Let's get some of this fluid off of you. Right. Get the pressure off your kidneys. We're probably going to lower the protein in your diet. Protein puts a bad workload on the kidneys. I love my big steak, but we're going to lower some of that to get some of the workload off your kidneys. We're going to give you medicines to protect your bones from those fractures, to treat your anemia if your blood count gets low, to boost your immune system, to get certain toxins and electrolytes out of your bloodstream. We're going to treat all those things individually as we try to treat this big cascade of a syndrome that is kidney disease. And then finally, again, as it progresses, you can get to an irreversible point where you've got to either go on dialysis, which is they hook you up to a machine to filter your blood, and you sit multiple hours a day for multiple days a week, and it's complete lifestyle change, complete. Or you can have a transplant where they take out one of your kidneys, and just usually one, and put in one of someone else's that's functioning more properly. Again, huge steps that end up taking at the end if we're not real careful early. Lesson from today, be careful early. Let's control the simple things: weight, smoking, diabetes, blood pressure. Let's not get to the point where we really have to deal with effective, chronic, never going away kidney disease.
You mentioned about the transplants. The most common person for a transplant partner would be who?
Family member. Because again, they're more likely that their blood type's going to match. Their, everything else is going to match up with you well. You're less likely to reject that organ, which happens. You put a transplant in the wrong person, perfectly healthy kidney, but your body just can't take it. Blood type's wrong or whatever. And so, most likely person is a family member. Absolutely. And again, you usually only need one. We can live very well with one kidney. It's really all we need. And so if you got a person with two healthy kidneys, them volunteering to give up one so that you can have a healthy kidney if both of yours are shot, it's very common. It happens quite frequently.
We're talking with the pharmacist Jacob Johnson over at Marble City Pharmacy. This morning's topic, chronic kidney disease. And for those maybe who are middle-aged and watching this morning, say, well, I don't have any issues like that. How can they avoid issues like this?
Simple things. One, go to a doctor regularly, because they don't have to do a surgical procedure and cut open your kidney to determine if you have a kidney problem. They don't have to do that. More often than not, simple blood tests, simple urine tests. They're doing more often than not when you go to the doctor anyway with blood tests. They're looking at factors that, hey, that number's a little off. We need to investigate the kidneys a little further. They're usually looking at that every time you go, and you probably don't even know it because they're not saying anything unless something's wrong. But so just maintain normal doctor visits. If they tell you to control your blood pressure and blood sugar, please by all means do that, because we want to avoid these. But so normal things.
And of course, if you have any questions, the pharmacist there at Marble City Pharmacy will be happy to talk with you in private to discuss this or any other topic that you might have. And being a pharmacist, you gotta make sure that client that comes in, that patient comes in, their best interest is at your heart.
Absolutely. When someone comes in, a lot of times they have issues that are either extremely worrisome or troubling to them, or they feel that they want to discuss very privately, or they think it's something we've never heard before. I can assure you, whatever you bring to us, it's not something I haven't heard before. We have side booth, we have actual closed door room. We can talk in private. But again, when you talk to us, we are listening, and we know that whatever you're telling us, if you bothered to come to us and talk to us, it's something bothering you. It's something that's important to you if you wanted to come talk to me about it. So we're going to take it seriously, and we're going to delve into it with you.
All right. Finally, this morning, we never want to leave the show without talking about our gift department. Spring is in the air, and spring's on the way, and that means new items in the gift shop.
New items, new clothing, Easter type things, Women do a lot more of this than we do. Whatever they consider spring type materials, I don't know. But yeah, those things are getting out. We're getting them on the floor. We're getting them sold. Better come get them before they're gone. But Beth, as always, does a great job getting us ready for the different seasons, and we're excited about it.
All right. Jacob Johnson, pharmacist at Marble City Pharmacy on Health Monday. Always good to see you, sir, and we'll see you in a couple of weeks.
Absolutely. Thank you much.
More Daybreak right after this.